So why are disinfection robots critical for hospitals and care homes?
In care homes and hospitals, it's a very unique environment. You're dealing with people with compromised immune systems, compromised health. And so it's a very challenging environment to deal with. So, and one of the biggest challenges in those environments is hospital-acquired immunity. So hospital-acquired immunity, if you're not aware, is people will actually go to the hospital and actually get an infection there based on the bacteria that are around. And this is actually a huge problem around the world. You know, in the US, you're looking at over 400,000 people that get hospital-acquired immunities every year. And what this leads to is longer hospital stays, additional costs to the hospital. A single hospital-acquired immunity can cost between $30,000 and $50,000 addition per patient to manage that patient. So, and furthermore, there's issues with staff. So staff are catching hospital-acquired immunities as well. And once again, you're looking at large costs for testing, replacing that staff, and so forth. So you're looking at huge costs for hospitals, and this is a major concern. And that's why they've been looking at ways to provide better sterile environments. And most hospitals do a great job on the first level of disinfection, where they're cleaning regularly. You're seeing a lot of hand cleaning and so forth. If they could do a better job of hand cleaning, it would be even better for the staff and the patients. But even beyond that, you still have infections. So the Mayo Clinic was interesting. They brought in UVC robots to work in their hospital. And what they found was actually a 30% reduction in hospital-acquired immunities. That's huge for them. You know, so you're reducing that, $400,000 or 400,000 people number by 30%. That's 120,000 fewer people that would be getting hospital-acquired immunities if every institution implemented that with just that one solution. Okay, so that's a huge cost potential savings for them, as well as the patient care that you can provide and that you haven't been able to provide. And there's challenges with COVID right now. You're seeing ICUs being at the top of their capacities. You're looking at hospital rooms being at the top of their capacities. And this is one way to make sure that stays lower, because hospital-acquired immunities are just adding to that capacity issue. So that's where UVC robots come in. Fogging robots are less used in hospitals. Okay, this is probably not the technology that's good. And the main problem with fogging robots is time. It takes a long time to process the environment with fogging. And number two, it leaves a residue. Okay, and that residue can affect equipment and electronics and so forth. And so that's a real concern, because the equipment there is very expensive. So really, they found UVC robots are perfect as a solution for hospitals, because they can go to where they need to be, disinfect the local area, and then move on and go back to where they're supposed to go. So, and the other thing is hospitals run 24/7. So it's really hard to say, okay, I need to close down this wing for half a day to fog it. No, you can't do that. But to say, okay, I can close this door on this room and disinfect it in 15 minutes. Yeah, well, that's a good solution. So that's why we're seeing UVC robots as the robot of choice in hospitals.
So how can they actually be used in hospital setting?
So what you could do is a great example is, so you have a patient, and patients have to be in and out of their rooms very often. So example, to do tests and so forth. Well, the UV robots can actually be pre-programmed. Or you can have someone come and call the robot, literally say, okay, come to room 149. And the robot drives up, comes up, say, okay, go into room 149. Okay, close the door, disinfect it. By the time the patient gets back from getting their CAT scan, their room has been disinfected. And this is their surfaces have been disinfected, the air has been disinfected. And so this provides a safer environment for the patient, a safer environment for staff.
So what about care homes? Are there any particularities in care homes which are different from hospital setting?
Yeah, there definitely are some differences in care home. How can we reduce huge death rates people are seeing in care homes. And is there something more people can do? You know, care homes have a lot of unique challenges, right? So you have public ones and private ones. And so, you know, you're getting to the financial part of it. You know, how can you cost effectively do this as well as manage it? Well, some of the challenges they're facing is, well, first, staffing. So, and we've seen that staffing is one of the concerns with these care homes. And so the staff just does not have enough time to properly disinfect things. And this is where robots can come in. They can augment everything the staff is doing. You know, it's critical for the staff to be washing their hands before they walk into every room, washing their hands before they do any procedures, washing their hands after they do procedures, and washing them again when they get out. That's the standard practices in a proper disinfection environment. But then on top of that, they have to clean all the surfaces, and manually cleaning is very time consuming. But the one thing they do have to their ability is that they can move these people in and out of their rooms. Okay, so then they often have events or things that they're doing, and they're trying to socialize them a little bit or bring them together. And if they can create good pod areas for them to socialize, which are properly barriered off and protected, that's not going to be an issue. But then they can wheel in the UVC robots, and the robots can clean that room in 15 minutes. So it doesn't take much time. So it's a very quick thing. So rather than the staff spending 45 minutes to clean the room, this robot is doing it in 15 minutes, right? And really, it doesn't affect the staff at all. They can go on taking care of patients and doing what they have to do. So the patient goes off to get a bath. Okay, let's disinfect their room at the same time. It can work in conjunction with the staff. And in terms of cost savings, it's huge. Okay, so now you're not incurring the costs of people getting sick and having to specially isolate and potentially have staff that you have to replace, and you can't find staff, so you're gonna have to pay more for staff. And that's a problem. Okay, so and this way you don't have to bring any external people in. It's a one-time cost. You get yourself covered, and you protect your patients, protect your staff. You just develop good processes internally for that, which is easy to do, and you've reduced potentially how much infection is going on. Another really valuable place is many infections are brought in from the outside, and not just by the caregivers, but by family visiting and so forth. So here's a great opportunity to maybe have special meeting areas that they meet with, or if they're doing that after a family leaves, you disinfect that area. So why you want to do that is just to make sure that more than one, let's say they did infect the person in their bed, but then that whole room doesn't remain infected to infect the staff, which then pass it on to other people. And that's why we're seeing tens of people getting infected in care home, because it gets distributed so quickly. And that's a challenge. We have to get that COVID out of the air within that first 3 hours. The sooner we can do it, the better. And this is a real opportunity for care homes to do that.
Mm-hmm.